Spinal cord injury. Spinal cord injury, it is classified as complete or incomplete injury or partial injury. The complete cord involvement resulting in total loss of sensory and motor function below the level of the lesion or below the level of injury. The patient total loss of sensory or motor function. That is known as complete cord involvement, complete spinal cord injury. But in case of incomplete cord injury or partial cord injury, it results in mixed loss of voluntary motor activity and sensation, and some tract will be intact here. Okay, that is known as the incomplete cord injury. Incomplete cord injury can be treated, and there may be a chance for the good prognosis. Incomplete cord syndrome, it is classified based on the lesions of involvement. First one, central cord syndrome, anterior cord syndrome, posterior cord syndrome, Brown-Sequard syndrome, then cauda equina syndrome and conus medullaris syndrome. So these all are the 6 syndromes based on the incomplete spinal cord injury. Central cord syndrome. Central cord syndrome, it is damage to the central spinal cord. Here, mainly due to extension injuries, it occurs. Due to extension injuries, central cord syndrome occurs, and common in cervical region and common in older adults. And here, motor weakness and sensory loss motor weakness and sensory loss are present in both upper and lower extremities. But the upper extremities are affected more than the lower extremities. So in this picture, you can see that upper extremities are more darker. That is affected more than the lower extremities. Brown-Sequard syndrome. In Brown-Sequard syndrome, it is due to the damage to one half of the spinal cord. Here, one half of the spinal cord is damaged. The blue area is the area of damage. So, the syndrome is characterized by loss of motor function and position, vibratory sense, as well as vasomotor paralysis on the same side. That is, ipsilateral side, there will be vasomotor paralysis. Then opposite side, contralateral side, there will be loss of pain, temperature sensation below the level of lesion. So that is regarding the Brown-Sequard syndrome. In Brown-Sequard syndrome, there will be damage to the one half of the spinal cord. This syndrome is characterized by loss of motor function and position, vibratory sensation. Here, the vasomotor paralysis occurs in the same side or the ipsilateral side, but in the opposite side or the contralateral side, there will be loss of temperature, pain, sensation below the level of injury. Okay. Posterior cord syndrome. Posterior cord syndrome result from the compression or damage to the posterior spinal artery. It is the very rare condition. Generally, the dorsal columns are damaged, resulting in loss of proprioception. However, pain, temperature sensation, and motor function below the level of this lesion remain intact. In posterior cord syndrome, posterior column is damaged. The shaded area, that is the posterior column or the dorsal column, that is damaged. That's why here there is vibration and proprioception loss below the level of injury. And other functions like pain, temperature sensation, motor function will be intact. The loss is mainly the proprioception. Okay, so that is regarding the posterior cord syndrome. Anterior cord syndrome. Anterior cord syndrome is caused by damage to the anterior spinal artery. This resulting in compromised blood flow to the anterior spinal cord. It typically results from injury causing acute compression of the anterior portion of the spinal cord or the flexion injury. So, the anterior cord syndrome, it is due to the damage to the anterior spinal artery, and it is common in flexion injury. The main manifestations are motor paralysis and loss of pain, temperature sensation below the level of injury. And here posterior cord tract are not injured, so that sensation of touch, position, vibration, motion remains intact. In anterior cord syndrome, here anterior spinal artery is injured and posterior cord is intact. That's why there will be sensation, touch, vibration. All these will be intact for this patient, and the pink area that indicates the area is involved. Okay. Conus medullaris and cauda equina syndrome. The conus medullaris syndrome and cauda equina syndrome results from damage to the very lowest portion of the spinal cord. That is, for conus medullaris, there will be damage to the conus, and the cauda equina, there will be the lumbar and sacral nerve root. That is known as the cauda equina. There will be injury to this area. Okay, so injury to this conus area and cauda equina area that produce flaccid paralysis of the lower limbs and areflexic or flaccid bladder and bowel. That is the conus medullaris syndrome and cauda equina syndrome. In conus medullaris syndrome, there will be damage to the conus area, that is the lowest portion of the spinal cord. The damage to the conus area will be occur. Due to that, there will be flaccid paralysis of the lower limb and also a reflexic bowel and bladder will be occur. The same way, in case of cauda equina syndrome, the lowest portion of the spinal cord, especially the lumbar and sacral nerve root, is affected. So that's why again there will be flaccid paralysis and the reflexic bladder and bowel function. Okay, so this is regarding the conus medullaris syndrome and cauda equina syndrome. In conclusion, spinal cord injury is divided into form complete cord injury and incomplete cord injury. In complete cord injury, the complete loss of vasomotor function below the level of injury. But in incomplete cord injury, there will be partial loss of motor and sensory function, because here some tract will be intact. Incomplete injury is divided based on the level of injury or the area is injured. It is divided in different syndrome, that is anterior cord syndrome, central cord syndrome, brown circuit syndrome, posterior cord syndrome, conus medullaris syndrome, cauda equina syndrome. Thank you.